How do doctors diagnose different anemia types in cancer? Imagine feeling unusually tired or weak and wondering what might be causing it. When it comes to cancer patients, anemia is a common issue, but figuring out what kind it is requires a careful, step-by-step process. Doctors start with a simple blood test called a complete blood count. This test measures how many red blood cells you have, the amount of hemoglobin in your blood, and the overall proportion of blood made up of red cells. It also looks at other details like the size of the red blood cells, which helps identify if the anemia is microcytic, macrocytic, or nomocytic. Next, they often examine a blood smear under a microscope. This involves staining a small sample of blood and looking at the shape and size of the red blood cells. Abnormal shapes or sizes can give clues about the type of anemia. For example, irregularly shaped cells might suggest hemolytic anemia, where red blood cells are destroyed prematurely. If the cells are unusually large or small, that can point towards specific deficiencies or conditions. This step helps doctors see what's happening at a cellular level. To understand whether the bone marrow is producing enough red blood cells, doctors measure reticulocytes, which are young, immature red blood cells. A low reticulocyte count indicates the marrow isn't making enough cells, possibly due to infiltration by cancer or damage from treatments. A high reticulocyte count suggests the body is trying to compensate for blood loss or destruction. If further investigation is needed, especially if marrow involvement is suspected, a bone marrow aspiration and biopsy are performed. This involves taking a small sample of marrow from the hip bone or another site and examining it under a microscope. It reveals whether cancer cells have invaded the marrow, if the marrow is producing blood cells abnormally, or if there is fibrosis or scarring. This step is crucial in lymphoma cases to see if the disease has spread into the marrow and caused anemia. Additional tests help pinpoint the cause of anemia. Iron studies, including serum iron and ferritin, help determine if iron deficiency is involved. Vitamin B12 and folate levels are checked to see if deficiencies are causing large, abnormal cells. Markers of hemolysis, like lactate dehydrogenase, haptoglobin, and bilirubin, reveal if red blood cells are being destroyed prematurely. Tests for inflammation or infection can also be useful since chronic illness often leads to anemia of chronic disease. In some cases, hemoglobin electrophoresis is done to rule out blood disorders like sickle cell disease or thalassemia. Understanding the patient's cancer history is also key. Anemia in cancer patients can result from the cancer itself invading the marrow, from ongoing inflammation, nutritional deficiencies, or side effects from treatments like chemotherapy or radiation. Knowing the type and stage of cancer, along with the treatments received, helps doctors interpret the test results accurately. In summary, diagnosing the type of anemia in cancer patients involves a combination of blood tests, blood smear analysis, marrow examination if needed, and targeted laboratory studies. This thorough approach helps doctors distinguish whether anemia is caused by marrow infiltration, nutritional deficiencies, hemolysis, or treatment effects. It's a detailed process that ensures each patient gets the right diagnosis and the most appropriate care. Always remember to consult healthcare professionals for personalized advice and treatment options.